As a RUCONEST Patient Advocate nurse, I have been very fortunate to be able to work with many families, patients and their families, and training them, educating them on how to mix, prepare, and administer their RUCONEST medication, working with them as many times as needed so that they can become comfortable with infusing their medicine. Also, working with their physicians, closing that gap, being that loop so that they will know how the patients are doing with their RUCONEST medication, how comfortable they are with administering the medicine, and how the medicine is working for them. As a RUCONEST Patient Advocate nurses, patients have a direct line to us. They can call us at any time. They have questions or concerns. They want to talk about their HAE disease, providing that support that they need. I've had so many families who share with me that it's a great feeling just to be able to call and talk to their advocate nurse about the disease. I've had an opportunity to work with many patients and their families on their journey, their HAE journey, receive positive feedback regarding taking their RUCONEST medicine. Their symptoms are controlled and they have that confidence and peace of mind that because their symptoms are now controlled, that they are able to go about their lives and have dinner with their families and go to the movies or even take a vacation that they have been putting off because they did not have that control or felt they didn't have any control over their managing their HAE. We work with families in creating their emergency care plans, working with the local hospitals, fire stations, clinics. The reason for this is to create awareness in the community. We want patients to be able to have backup assistance for infusing their medication when needed. We want to create that awareness so that these facilities will even know what HAE is and how to treat it. Our goal is we want patients to be able to be treated with the respect and dignity that they need and to be able to get the proper treatment and assistance when they need it. Words cannot even describe what I find most rewarding with working with HAE patients and their families. It's really been a ministry for me, and it's so rewarding to know that just picking up the phone when somebody calls and has a question, that they can call me directly anytime. It's just been amazing for me to be invited into the lives of patients in their most vulnerable state. And they trust me, and not just me, but all of the RUCONEST Patient Advocate nurses and our entire team. They trust us to ensure that they're going to have the therapy that they need, the support that they need. They're going to feel confident and they can gain some control over their life. It has just been an amazing journey for me, and I feel very privileged to be in that position.
What is RUCONEST? RUCONEST is an injectable medicine that is used to treat acute angioedema attacks in adult and adolescent patients with hereditary angioedema, HAE. Who should not use RUCONEST? Do not use RUCONEST if you have experienced life-threatening immediate hypersensitivity reactions, including anaphylaxis, to RUCONEST or to any other C1 esterase inhibitor product. Call your healthcare professional or the emergency department right away if you experience wheezing, difficulty breathing, chest tightness, lips and gums that turn blue, fast heartbeat, swelling, faintness, rash, or hives. Do not use RUCONEST if you have a known or suspected allergy to rabbits or rabbit-derived products. If you do not have a known rabbit allergy, testing is not required. RUCONEST is not indicated for use in children under the age of 13 years. What should I tell my healthcare provider before using RUCONEST? Tell your healthcare provider about all your medical conditions, including if you have a known allergy to rabbits. Tell your healthcare provider about any other medications you are taking, as some medications, such as birth control pills and certain androgens, can increase risk of clotting problems. Also tell your healthcare provider if you are pregnant, breastfeeding, or planning to do so. RUCONEST has not been evaluated in pregnant women or nursing mothers. You and your healthcare provider will decide if RUCONEST is right for you. How is RUCONEST given? RUCONEST will be dissolved in sterile water and slowly injected into your vein. What are the possible effects of RUCONEST? The most common side effects patients experience during clinical studies include headache, nausea, and diarrhea. These are not all the possible side effects of RUCONEST. If any of the side effects get serious, or if you notice any side effects not listed here, please inform your healthcare provider or pharmacist. You can also report side effects to the FDA at 1-800-FDA-1088 or visit www.fda.gov/medwatch. For product information, please contact Pharming US toll-free at 844-474-2764. For adverse events and product complaint reports, please call 800-930-5221. Please visit www.RUCONEST.com for full prescribing information, including patient product information.